So a little bit about hand expressing. This can be useful to know about if your baby is a bit sleepy after delivery to provide colostrum in the first few days. It can stimulate milk production. It can help soften the breasts by removing milk if you're feeling a bit full. It can help manage blocked ducts, which in turn can prevent mastitis. And it can be just a gentler way of removing milk from the breasts, and it's also convenient and it's free. So we're going to look at the picture that we showed earlier of the anatomy of the breast. We have our nipple openings, and on average these are about between 9 and 14, and also our milk ducts. And the milk ducts is what we're going to be focusing on when we talk about where to place our fingers and thumb when hand expressing. We've already discussed milk production hormones when baby attaches to the breast, and babies stimulate these naturally when they're feeding. So when we express, we need to think about how we can stimulate these hormones ourselves. So if baby isn't with you, it can be useful to get a blanket which smells of them, or look at some photos, because what we're trying to do is we're trying to stimulate that oxytocin hormone, which is also known as the feel-good hormone, and the milk ejection reflex, which helps release that milk. To help with this, we can also do some gentle hand massage of the breast and the nipple, and this can also help us to get to know our bodies and how our breasts may have changed through pregnancy and breastfeeding. And also with this gentle hand massage, we can be also thinking about locating those milk ducts on the previous slide. So we've got a video here that demonstrates hand expressing. And we're going to talk about how to actually do it. So we're going to cup the breast with fingers and thumb in a C shape, about 2 to 3 centimetres back from the base of the nipple. We're going to gently squeeze, bringing the fingers and thumb together in a rhythmic action. It might take a while for the colostrum to appear, and remember, colostrum is only made of small amounts. But if no milk appears after a few minutes, reposition your fingers and thumb and try again. Once the milk appears, continue this action until the milk ceases to flow, and then move the fingers around the breast to express from different sections and milk ducts. Avoid sliding your fingers along the breast, as we don't want to damage the breast tissue, and then this milk can be collected in a sterile cup, bottle or syringe, dependent on the age of your baby and the reason for hand expressing is being used.